Welcome to today's episode of Navigating Nursing School with your nursing tutor. Today, I want to talk about the fact that it is no secret that nurses have a problem with self care. But here's an unpopular opinion, and I'm going to explain it in today's episode. That self care crisis in nurses starts in nursing school. Do you feel it yet? Are you currently in nursing school, or are you a pre-nursing student who's like, yeah, I can hear that in all the horror stories that people are telling me, whether I want to hear them or not. We're going to talk about that today. And we're going to talk about how you can avoid this and, have a more healthy nursing school experience to set yourself up for success and prevent burnout once you do become the amazing, wonderful nurse that I know you are destined to be. If you haven't met me before, my name is Nicole. I am the founder of Your Nursing Tutor, and I've been a professional nursing tutor for over 15 years. I provide group tutoring memberships, one-on-one tutoring, and standalone pre-recorded classes to help you get through nursing school confidently and calmly. And I share a lot of free tips and strategies via this navigating nursing school with your nursing tutor, as well as all my social media channels, which I would invite you to come follow me on. So you can also find me on my website. I guess I always forget to say that at yournursingtutor.com. And in fact, if you want a free overview on how to study the best way in nursing school, you can learn more about my Silver Bullet study system by going to yournursingtutor.com/SBSS. That's for Silver Bullet Study System. yournursingtutor.com/SBSS and request a free overview. It's a 10-minute video where I teach my entire 4 steps in my Silver Bullet study system so that you can feel better about the way you study in nursing school and make sure that the way you're studying is going to effectively help you get comfortably passing grades in nursing school. Let's talk about today's topic, which is self-care among nurses, which is pretty terrible, generally speaking. It is getting better. It is getting better. However, what we don't want to see is, after COVID, we've heard that a lot of the nurses have retired and gotten out of nursing because they're just so burnt out and they don't want to do it anymore. That's one form of self-care, unfortunately, for the rest of us who like having enough nurses out and about. But what can we do to actually enjoy your job before getting to that point? Now, I'm going to talk specifically about nursing school because as a professional nursing tutor, that's my area of expertise, is working with students in nursing school. And I have opinions. I definitely have opinions on how the nursing school system in general is set up to treat nursing students. And it's a little bit ridiculous. It's a little bit ridiculous. I will just add this first, that when you're a nurse, and this is going to be for you, like you new grads, you're going to be a new grad eventually. Let me give you some advice about self-care for when you're a nurse. Your employer will treat you the way that you train them to treat you. Okay. So if they're giving you too many patients, if they're not paying you enough, if they are not paying you, if you're working through your lunch break and they're not paying you, which is illegal, by the way, all of these sorts of things, like you're not being treated the way you deserve to be treated, find another job. Find another job. You're probably not going to fix that job, but you can vote with your employment. You can always vote with your employment. So look for employers who are going to treat you the way you deserve to be treated. That's like the first step. But that's when you're a nurse. Let's talk about nursing school, because in nursing school, you don't always have that freedom, right? Like you can't just be like, I'm just going to go look for another nursing school. You can do that, but obviously, for a lot of reasons, that's not going to be your first choice because you're probably going to have to start over, because nursing schools do not like to transfer credits to other nursing schools for your nursing classes. That's a whole nother, we could talk about that. There's arguably good reasons for that. But it just doesn't happen very often that they will accept your credits. It also tends to be very expensive, again, for that reason alone, because you have to start over from scratch. So what can you do to manage your self-care in nursing school? Because I'm sure you've heard the horror stories. First of all, don't accept the toxic narrative as normal. I think that's the first thing. I know people use the term gaslighting a lot, kind of inappropriately, but I feel like this might be It? I don't know. Like there's a lot of jokes and memes out there that imply that when you go to nursing school, your life is over while you're in nursing school, that you're not allowed to have fun, that you say goodbye to your family and friends, that you don't shower, that you're only going to be eating peanuts picked out of the glove compartment of your car. Okay? That is not funny. So I want to start that right up front. That is not funny. And we should not be making jokes about that, because when we make jokes about it, it normalizes it for the other nursing students. And so here, me as a registered nurse, I am telling you that is not okay for you to feel that way. For you to feel as a nursing student, it's not okay for you to feel like that stuff should be normal. That crying in your car on the way home from your first day of nursing school is normal and you should just deal with it. That is not okay. That should not be the status quo. Okay. And if you have experienced those things, I am sorry. And I apologize for, on behalf of the nursing profession, that you had to go through that, because it should not be that way. Um, so what can we do though? What can we do to work within the system that you have, which again does have some toxic traits sometimes? What, because you are in the system and you have to learn to navigate your self-care within this system that normalizes some things that should not be normalized. Okay. So the first, and by the way, I'm going to tell you up front, none of my self-care tips involve taking a bubble bath. Because that's what they always used to say. Even when I was like a young mom with like little kids, they're like, "Oh, take care of yourself, lock the door and light a candle and take a bubble bath." I'm like, that's not fun when there's a kid screaming at the door, right? And so, and in nursing school, I work with a lot of adult learners who are in their late 20s, 30s, 40s, even 50s, and are going to nursing school for the first time. You guys got responsibilities. A lot of times you might be working, you have family, you have things you need to do to take care of your adult life. You don't just have time to do a random bubble bath. Like, that might be nice, but that's not really going to feed your soul. So, what were the first tip that I have for self-care for nursing students is you have to put your blinders on and have realistic expectations. Okay. That's two. Let's back up. Put your blinders on. You have to know what you have control of and what you do not have control of. Okay. There are going to be things in nursing school that you do not have control over, like when you find out about clinicals, or what your clinicals are and where you have to go. Sometimes you have to travel far. And I will tell you, there's a reason for this. Like, you're not going to be able to change that because it already is very difficult. This is not an excuse. It's just a reason so that you can understand, because I think understanding leads to empathy, which makes it easier sometimes to put your blinders on and just be like, yeah, that's not fair, but that's the way it is. And I'm just going to deal with it for right now and keep my head down to meet your goal of becoming a nurse. So nursing schools often have a difficult time uh, setting up clinicals because they are dependent on the hospitals in their area to just let them come in. Okay. And so it really depends on the hospitals to decide like how many students they'll allow, which floors, what units, what days and times, and things like that. And that's going to depend on their staffing, which obviously is harder than ever nowadays, and things like that. So don't get too upset with your nursing school if it seems like they're dragging their feet announcing information about clinicals. It's totally frustrating, but in this one instant, it may not actually be their fault. It may be the hospitals that are dragging their feet with the information, so they can't get the information to you in a timely manner. But things like that, you just can't get worked up about, because it's just going to be the way it is. And so you have to keep your blinders on and know what you can control and what you can't. What you can't control, you just have to let go of. Let go and let God, as they say, and just focus on the things you can control. Now, another example of things you can control is your grades, but only to a certain extent. Okay, this is why I call myself the tutor that will not help you get straight A's in nursing school. And some people look at me kind of side eye at that, but I don't want you to focus on getting straight A's in nursing school, because it may not even be possible for you to get straight A's at nursing school. And so I don't want you to feel like a failure when you're doing fine, but you're just not getting straight A's. It is very, very true that C's get degrees and C equals RN and all of those things that people say. Uh, as long as you are getting comfortably passing grades. Like, I don't want you freaking out because you're right at the borderline all the time. But if you're getting comfortably passing grades and you're understanding the content, those are my two criteria for a successful nursing student who can be confident and calm and relaxed. Um, because if you're doing those things, you're going to be a great nurse, you know? Now, the reason why you don't have complete control over your grades is two reasons. One, they almost always change the grading scale in nursing school to make it more difficult. So when I was in nursing school, I had to get 78%, minimum grade of 78% to pass. And, as a tutor, I hear about all kinds of nursing schools. And I think the most common range that I hear is probably between the 75 to 80% range. There's obviously schools that are outside of that range, but that's the most common average that I see. And so that's difficult. That's more difficult to get straight A's when you already have that adjusted grading scale. The other thing is that you have no control over whether your instructor is good at writing test questions or if they even write fair test questions. Now, notice I didn't say whether your instructor is good or not, because you do not need to have a quote unquote good instructor in order to do well in nursing school. In fact, I would encourage you to forget about your instructor and focus on becoming an independent self-learner. That's what I teach students to do using my Silver Bullet study system. Again, yournursingtutor.com/SBSS if you want a free 10-minute video teaching you how to study the best way in nursing school. But when you study this way, when you know how to study like a nurse thinks, you could get through the lecture part of nursing school on your own. Like, you don't need an instructor anymore because you're going to understand things. But what you can't control, so you can control the study things, you can control whether you understand or not. What you cannot control is going to be the test questions. And I'm not saying like you're studying the wrong way and you get to the test and you just don't understand what it's asking. I'm saying that like they just have not statistically normed their test questions. They're not good test writers, things like that. There's going to always be some bad test questions, and you can't control how many of those are going to be on your test. So some are going to get thrown out and it's fine. Or they're not going to get thrown out and you just have to take the lost point and whatever, because as long as you have comfortably passing scores, you're doing good. So notice what I've said so far is a lot of mindset stuff. It's changing your mindset towards how you approach nursing school, letting go of things that you can't control, so that you can focus on the things you can control and make your own priorities. So that's my summation of my first self-care tip for nursing school. Now, my second one has to do with time management. It has to do with time management. And here's the thing with that is statistically, most people who go to nursing school are women. And in my experience, yes, it's a little stereotypical, but I am a woman, so I am going to make this stereotypical comment. As women, we tend to expect too much of ourselves. Let's put it that way. I tend to overestimate how much I can get accomplished in a certain time period. And so I might make a to-do list that has 10 items on it and be like, I'm going to get this done in 2 hours. And 2 hours later, I have done, 3/4 of one item, right? Because I was not realistic with how long it would take me to actually complete each item, because everything always takes longer than you plan, right? Am I right? It's going to be the same way in nursing school. But here's the thing. A lot of you, especially because a lot of you are adult learners, you're already, like, your schedule's already probably packed out with working, with kids, with paying bills, with keeping your house clean, walking the dog, like all the things, right? And now you are adding nursing school. And in your head, you're like, oh yeah, I'll just squeeze in nursing school without taking anything else off. No, you can't do that. So the number one trick to improving your self-care in nursing school is to take things off your plate. Because if you just smush nursing school on your plate with everything else that's already there, things are going to fall off your plate, just like they do at a buffet. Okay. And so you need to take something off your plate. Now, what can this look like? It can look like, but first of all, though, before you hear me say, like, stop doing the fun stuff, that's where those memes that I hate come from, right? Let me make it clear. you get to decide. You get to decide what stays and what goes. I don't care. It's not my judgment call. Even if it's something that personally in my life I don't care about, I might think is dumb. If it's something you love doing, by all means, please keep doing it. That is like literally the definition of self-care right there. Okay? So think about it like you're budgeting your time. A lot of people don't like to financially budget because they feel like it's too restrictive. But when it's done correctly, it's actually freeing because now you're being realistic with your money. And so if I say, hey, I want to go spend $10 on a fancy coffee, well, I planned to do that. So when I go buy that fancy coffee, I don't have to feel guilty about it. The money is there. I planned for it. And it's the same way with your time. If you really, really want to spend however much time per day scrolling TikTok or watching that new TV show that's coming out on Netflix, just budget your time for it. It's fine. You can do that when you're in nursing school. You shouldn't feel guilty about it. Now, one thing that does help is if, again, not to beat a dead horse, but if you have a study strategy that you know is working, and so that you have comfortably passing grades, then it's easier to say, yeah, it's okay for me to take a half an hour and watch this show and kick back with a glass of wine before bed or something like that, right? If you're feeling anxious and fearful, then you're never going to feel like you can take a break and you're going to engage in fear-based studying. That is a recipe for burnout. Recipe for burnout. Okay. So it's all about taking things off your plate. Taking things off your plate. I do have trainings on time management inside my group tutoring membership. It's included in the monthly group tutoring membership because I have some exercises that I always take people through so that you can decide for yourself what's important. You know, when I was in nursing school, you know what I took off my plate? I took off my plate cleaning the bathroom. And I have people like kind of like, that's another thing people look at me side eye for. I'm like, but seriously, uh, did I really need to clean my bathroom as often as I did? I proved that I did not. Okay. Now, if I had guests coming over and I knew I could do a quick wipe down of the guest bathroom, and that would be fine. But doing like a weekly bathroom deep clean, guess what? I didn't have to do that when I was in nursing school and I survived. Other things I gave up, I think I had been volunteering at my church and I backed off a little bit. I didn't stop completely, but I reduced the amount of volunteering I was doing at my church because it was only for a season. And then I was able to pick it up again once I graduated. But for a season of life, just because I say no to something now does not mean I'm saying no to it forever. I'm saying no right now to make room for my goals and the things that I want to do and taking care of myself because you are worth it. Okay. And so I would encourage you, and again, like I said, I have tools that I, in my group tutoring membership, if you're interested in getting those, you can join, that will walk you through a process of identifying what your current obligations are realistically, helping you prioritize which ones are actually important to you, even if it's not what would be important to me, it doesn't matter. It's what's important to you that matters. And then, and prioritizing those so you can choose which ones do you plan to continue doing during nursing school and at what rate, like how much are you going to do of them, and which ones are you going to cut out. And once you have that, it's going to give you a realistic sense of what you really have the capacity for. Because a lot of times, let's be honest, this is what causes burnout, is when we have unrealistic expectations for yourself. So if you expect to add nursing school to your plate and just not stop doing anything else, just keep doing everything else you've always been doing, you're going to get burnt out. I'll tell you that right now, because you're already doing too much and now you're adding more. And you have this unrealistic idea that you should be able to do it. And if you can't do it, there's something wrong with you. There is nothing wrong with you. You're just trying to do too much. You're just trying to do too much. So you go through a process and figure that out. If you happen to be listening to this when I have one of my pre-nursing boot camps available, that the time management, I think that's day 1 of my pre-nursing boot camp when I do it live, that I walk you through the tools. There's 3 tools that you can easily go through and figure out how to budget your time and prioritize for nursing school, just to immediately give yourself some space for self-care. Because like I said, self-care does not equal bubble baths. Self-care equals making sure you have time to do the things that are important to you. And that's really, everybody deserves that, even in nursing school. So, if you would like more information about my pre-nursing bootcamp or the Silver Bullet study system, so you can stop studying fear-based and have more of the mental energy to relax, you can go to my website at yournursingtutor.com and find information about the different ways to work with me. That'll include all of that. And in the meantime, I would appreciate it if you could just do one quick thing for me. If you got any value from this episode today, please go to Apple Podcasts and leave a 5-star review for this episode. That really goes a long way. Or if you're watching on YouTube, because I post this on YouTube too, hit the subscribe button. Give me a thumbs up for this video. It helps other nursing students find out more about how to get through nursing school confidently and calmly without going crazy. Because trust me, when you graduate and become an amazing nurse, you're going to want other amazing nurses at your side. You're going to want a new generation of amazing nurses coming up behind you. And so it's going to pay off. It's going to pay off if you help other nursing students learn how to do these same things that you're learning now too. So until next time, good luck on your nursing school journey.